Student, today we are going to discuss about a new topic, that is NSAIDs or non-steroidal anti-inflammatory disease. In previous class only I have explained you about the autogoid, what are the autogoids, their system, and then I have decided and I have discussed about the detailed explanation about the autogoids like histamine, prostaglandin, their mechanism of action, release, how they are going to act in our body, their different therapeutic usage, their pharmacological action in our different part or different system of our body. All this we have discussed into the previous classes. I am requesting you to go through that autocoid chapter, then histamine and then prostaglandin to better understand the topics that I am going to discuss from today and onwards. So today the topic is NSAIDs. That NSAIDs also is related to the autocoid, and here also autocoid plays an important role in showing the action of showing or playing the action of NSAIDs. So autocoids also plays an important role in that non-steroidal anti-inflammatory drugs, because most of the drugs show their action by inhibiting the action of one autocoid, that is prostaglandin. That prostaglandin is generally act as the main autocoid in our body and affects on different system and helps in the function to pursuing different functions in our system like endocrine system, eye system, blood system, CVS, CNS, different system. Prostaglandin generally plays an important role as a autocoids, and that NSAIDs or non-steroidal anti-inflammatory drugs also shows their action mainly by inhibiting the action of prostaglandin as an autocoids. So first now we have to understand what is NSAIDs and why we should use that NSAIDs and what is the definition of that. The full name of NSAIDs is non-steroidal anti-inflammatory. So from that name only you can understand NSAIDs, it is a class of some drugs and medication we generally used in our daily life to decrease or to get free or relief from pain and inflammation by inhibiting the mediation of prostaglandin from different system or cell of our body and helps in responding against body injury. So when our body get injured by some external body or some internal body, anyhow that body injury can occur. Due to that our body started to release different autocoids, mainly they synthesize or release prostaglandin, and that can cause in pain and inflammation into the different part of body, especially in muscle. So to treat that pain or inflammation, to counter that pain, to get relief from that pain and to decrease the inflammation of that particular injured part, we should have used a drug or a class of drug which can act as the opposite of prostaglandin, and it can inhibit the pain and inflammation by inhibiting the prostaglandin secretion from different cell as a response to the body injury. So this is the definition of non-steroidal anti-inflammatory drugs. These are the class of drugs which generally helps us in to get relief from pain and also to decrease inflammation of our body due to body injury by inhibiting the secretion of prostaglandin from different system or cell of our body. So now we'll discuss about the different classification of NSAIDs, and then we will go through the pharmacological action. So before going to that, you have to understand that how prostaglandin generally works. That I've already discussed in the previous class, but now also you have to just remember that one line that can help to understand NSAIDs better. When the body is get injured by anything, just think injury takes place in our body, then what it will happen, it will cause the secretion or production of prostaglandin. That prostaglandin will lead to the improvement of arachidonic acid. I in previous class only I have told you how that prostaglandin generally released from arachidonic acid. That arachidonic acid will convert it into amino acid. That amino acid will synthesize into two things. One is cyclooxygenase, from that name only you can understand COX, and another one is lipoxygenase or LOX. In that also two types are there. In COX two types are there, is COX1 and COX2, and in LOX also two things are there. One is LOX1 and LOX2. So from arachidonic acid, prostaglandin generally secreted more when that injury takes place in our body. It leads to the production or change in amino acid. That amino acid then further classified or further synthesized into cyclooxygenase and lipoxygenase. Then there are two types of cyclooxygenase, COX1 and COX2, and two types of lipoxygenase, LOX1 and LOX2. So that simple thing you have to remember to understand better about the mechanism of action of NSAIDs and their various pharmacological action in our body. So before going to that mechanism of action, that is very vast and very important topic for that, and the pharmacological action and the pharmacokinetic dynamics and adverse effects, we have to know about the different classification of NSAIDs drugs. That means what are the classifications that generally we use as NSAIDs in our daily life to get relief from pain and to decrease inflammation. What is that classification? First classification is non-selective COX inhibitors. From that only you can understand it will act on both by decreasing the synthesis of prostaglandin of both COX1 and COX2, as it is a non-selective type of drugs. In non-selective type of drugs, according to their chemical structures, different drugs classifications are there. So we will study one by one. First one is salicylic acid derivative. In salicylic acid derivative, example of non-steroidal anti-inflammatory drug is aspirin. That aspirin is the most important topic that generally asked in the different competitive exam and in your semester exam also. So that aspirin only you have to understand and you have to study in depth. That I will discuss in today's slide only in after slides. So just now check that names and classification. First one is non-steroidal selective COX inhibitors. In that type of chemical structure is salicylic acid derivative. Example is aspirin. The second type is propanoic acid derivative. In propanoic acid derivative, NSAIDs example is ibuprofen. And another type of non-selective COX-2 NSAIDs, according to their chemical structure, is acetic acid derivatives. In acetic acid derivative, the example of NSAIDs is indomethacin. So the first classification of NSAIDs is non-steroid, non-selective COX inhibitor. That means it will act on both COX1 and COX2. And here different chemical nature, they are classified into different part. One is salicylic acid derivative, example is aspirin. That is the most important that we will go to discuss into the upcoming slides. Then propanoic acid derivative example is ibuprofen. And third type of non-selective COX inhibitor NSAIDs is acetic acid derivative. Example is indomethacin and ketorolac. Now we will discuss about the second type of NSAIDs. What are those? The second type of NSAIDs is preferential COX-2 inhibitors. From that name only you can understand this type of NSAIDs or non-anti-inflammatory drug will act on particularly or mainly on COX-2. From that name only you can understand preferential means it will prepare more to inhibit the action of COX-2. So what are the example of preferential COX-2 inhibitors in NSAIDs? The example of that are diclofenac sodium, and second one is aceclofenac sodium. So these are the two examples of preferential COX-2 inhibitors that generally shows their action by inhibiting the action of mainly COX-2 or cyclooxygenase 2. The third type of NSAIDs classification is selective COX-2 inhibitors. From that name only you can understand it will also show their action by decreasing or inhibiting the synthesis of cyclooxygenase. Example of selective COX-2 inhibitors are celecoxib and pericoxib. So in selective COX-2 inhibitors, NSAIDs example is celecoxib and pericoxib. Then the fourth type of NSAIDs is drugs having mild anti-inflammatory action with antipyretic. From name only you can know antipyretic that generally used to treat fever or decreasing temperature and with property of analgesic. So fourth type of NSAIDs is mild anti-inflammatory drugs with some properties of antipyretic and analgesic property. Example is according to their chemical structure is para-aminophenol. In that para-aminophenol, example is that is generally used in our daily life as analgesic and antipyretic mostly, that is paracetamol. And the second type of this type of drug is benzocaine derivative. Example is nifopam. So the fourth type of NSAIDs is anti-inflammatory drug with mild antipyretic and analgesic effect. Example is according to their chemical structure para-aminophenol derivative is paracetamol, and fourth type is benzocaine derivative, example nifopam. So what are the classification of NSAIDs I have discussed? First one is non-selective COX inhibitors, example were aspirin, ketorolac, indomethacin, ibuprofen. Then next type we have discussed about non-selective or preferential COX-2 inhibitors. In that we have studied about example is diclofenac sodium and aceclofenac sodium. Third one we have studied about selective COX-2 inhibitors, example were celecoxib and paracoxib. And last and fourth type of NSAIDs is non-anti-steroidal inflammatory drugs with mild antipyretic and analgesic effect. Example were in para-aminophenol, paracetamol, and the second is benzocaine derivative, exam is nifopam. So by that I have discussed about the classification of NSAIDs. In NSAIDs, when I have discussed about the classification of NSAIDs, I have told you the most important drug that generally used in our daily life as an anti-inflammatory drug, and generally in competitive exam and in that semester exam, they generally ask about the details review of anti-inflammatory drug aspirin. They generally ask mainly in question for 10 mark in semester question, and most of the competitive exam also they have asked that is tell or describe about the details in aspirin as a successful and most used anti-inflammatory drug. So I will discuss now about the details of aspirin in very deep and in details. So first we have to know what is the simple structure of aspirin. First check the ring. That is one benzene ring. Yes. On C double Y. Yes. OCO CH3. That is the structure of aspirin. By the structure only you can understand that is consists of a acidic bond. So that is also derived from salicylic acid, I have told you, and you all know the salicylic acid structure is like C double OH, yeah, OH. That is the structure of salicylic acid, and that is the structure of aspirin. As that OH is replaced by OCOCH3, but acidic bond is there, so aspirin is a derivative of salicylic acid that is generally used mostly as anti-inflammatory disease in anti-inflammatory drug in our daily life. How that aspirin generally do act and enters in our body? When we generally took aspirin, that aspirin is taken into the body. When that aspirin is taken into the body, what it will happen? It will converted into in body, it will converted into salicylic acid. So after entering into our body, that salicylic acid will converted into the salicylic acid. So when we are taking that aspirin in our body, that aspirin in our body is converted into the salicylic acid derivative. That salicylic acid derivative generally cause acetylation of different macromolecules including COX. That can be COX-1 and COX-2. So how aspirin generally act? When we are taking aspirin in our body, that aspirin, as it is a derivative of salicylic acid, when aspirin is entering into our body, that aspirin is generally converted to the salicylic acid. It can cause the acetylation of some macromolecules that are present into our body, including COX-1 and 2, and we all know by inhibiting or acetylation of COX-1 and 2, most of the anti-inflammatory drugs show their action. Aspirin is also no other choice and no other action. Aspirin also the same. It will go into the body, it will convert it into the salicylic acid and cause the acetylation of macromolecules of cough, and it leads to the decrease in release or synthesis of prostaglandin, and it can cause relief from pain and also can decrease in inflammation in our body. So aspirin is generally used in our body, that is more old and more frequently used drug, more frequently used drug. So that was how aspirin is going to into our body and going to show their action by transforming into salicylic acid and cause acetylation of COX, and the decrease of synthesis of prostaglandin leads to relief from pain and decrease in inflammation. Now we are going to discuss about the pharmacodynamic of aspirin. In pharmacodynamic of aspirin, first one that we have to study is pharmacological action of aspirin. In pharmacological action in different system, it generally shows different types of pharmacological action. One by one, according to that system, we will study their pharmacological action. First is the pharmacological action of aspirin as a analgesic and antipyretic. So first one is the pharmacological action of aspirin as a analgesic and antipyretic. First, when will you compare the property of analgesic, you have to remember aspirin as an analgesic is less effective than morphine type of drugs like codeine. How you can compare that 600 mg of aspirin is almost equivalent to the 60 mg of codeine. That means to decrease your body pain, only 60 mg of morphine is enough. Instead of taking morphine of 60 mg, we have to take 600 mg of aspirin. So clearly you can see in analgesic property, aspirin they are generally less effective than morphine because they need more dose to decrease the inflammation and to cause relief from pain. So in case of analgesic property, aspirin is less effective and require more dose than morphine type of drugs. Example is codeine. But in case of inflammatory disease or inflammatory mediators, it generally act as very effective anti-inflammatory drug. How they generally act as very effective anti-inflammatory drugs? They generally cause the decrease or inhibition of prostaglandin mediated sensitization in different muscle, including and most of the time skeletal muscle. Though the analgesic effect of aspirin is less than morphine type of drugs like codeine, but in case of anti-inflammatory, it has a very effectiveness as an anti-inflammatory drug, especially in skeletal muscle and different muscle. How they generally do that thing? By decreasing the sensitization of prostaglandin, that leads to the less secretion of prostaglandin. But you have to understand or remember, analgesic don't have any action in case of pain in visceral pain and ischemic pain. So what you have to understand about aspirin? First one is pharmacological action of aspirin as an analgesic and antipyretic drug. You have to remember, as an analgesic, it is less effective than the morphine type of drug, example is codeine. But in case of anti-inflammatory drugs, it is very effective and it can cause anti-inflammatory effect by inhibiting the prostaglandin sensitization in different nerve ending, causing the decrease in different pain or inflammation in muscle, including skeletal muscle. But you also have to remember that aspirin can't show any anti-inflammatory or analgesic effect in case of pain in visceral pain and ischemic pain. So in case of visceral pain or ischemic pain, that NSAIDs can't be used. Only in case of relief from pain in skeletal muscle and in nerve ending, we can use that aspirin. In case of visceral pain and ischemic pain, there are no effect by aspirin. The second pharmacological action in metabolism. So now we'll discuss about the pharmacological action of aspirin in metabolism. What it generally do? It generally promotes cellular metabolism. How this cause the increasing? Due to uncoupling oxidative phosphorylation. Due to uncoupling in oxidative phosphorylation, it will increase the cellular metabolism, as it is causing cellular metabolism increasing and uncoupling of oxidative photosynthesis or phosphorylation. It can lead to the high production of heat. That high production of heat leads to high glucose use, and that high glucose use can lead to the decrease in blood sugar. That is one sign of diabetes. So in metabolism, how aspirin show their pharmacological action? In aspirin, generally in pharmacological action, aspirin increases the cellular metabolization due to the uncoupling of oxidative phosphorylation, and that oxidative phosphorylation cause in increasing production of heat, and that heat production leads to the overutilization of glucose, and that overutilization of glucose can lead to the decreasing in blood sugar level, that can cause diabetes too. So that was the pharmacological action of aspirin in the cellular metabolization or in cellular metabolism. Now we'll discuss about the pharmacological action of aspirin in maintaining acid-base balance and electrolyte balance. That activity of aspirin is generally dose dependent. So according to their dose only, they will show that action. In case of analgesic dose, it will not show any effect. So in analgesic dose, it will not show any action in acid-base reaction. But in case of anti-inflammatory dose, it will show action and it will maintain the acid-base balance and the electrolyte balance in our body. So you have to remember, in case of electrolyte and acid-base balance in analgesic dose, aspirin has no effect, but in anti-inflammatory dose, aspirin generally shows an important role in maintaining the balance of acid base and electrolyte into our blood plasma of our body. So that was the pharmacological action of aspirin into the balancing of acid base reaction and electrolyte balance. Next is urate excretion. It depends upon the consumption of aspirin. That means how much you are taking that aspirin. If that consumption is less than 2 mg, if that is less than 2 gram per day, 2 gram per day, then it will do urate retention. If we are taking the drug as 2 to 5 gram per day, then there will be no effect. And if we are consuming more than 5 gram per day, then it can cause urate excretion. So according to the how much we are consuming aspirin, it can show urate excretion. If it is less than 2 gram per day consumption, it will cause urate retention. If it is consumption is 2 to 5 gram per day, then it will show no effect in urate consumption or retention. But in case we are taking more aspirin, more than 5 gram per day in our daily life, then it can cause urate excretion. So it was the pharmacological action in case of urate excretion. Last, what I am going to discuss about aspirin pharmacological action is the action of aspirin in blood. In blood, what generally it do? It increase or prolong the bleeding time. Why it is bleeding time increase? Because it decreases the platelet aggregation time, and due to the less platelet aggregation, it causes the inhibition of clotting. So due to the decrease in platelet aggregation, clotting time generally decreases. In this case, bleeding started to prolong up. So high consumption of aspirin can cause prolonged bleeding time due to the inhibition in platelet aggregation and inhibition in blood clotting. But this effect can be overcome easily by vitamin K therapy. So if we are taking aspirin in high quantity, it will prolong the bleeding time due to the inhibition in platelet aggregation and inhibition in clotting of blood. But this effect can easily be overcome by the vitamin K therapy. So it was the pharmacological action of aspirin. So by that I have finished up the pharmacological action and pharmacodynamic of aspirin on our different system or different part of our body. Now we will discuss about the pharmacokinetics of aspirin. And in pharmacokinetics, we know what we have to study. We have to study about the absorption, distribution, metabolism, and excretion of that particular drug. Here we will study about aspirin. So we will remember it in point by point, so you can easily understand their pharmacokinetics of aspirin. First one is absorption. They generally absorb in stomach. They generally absorb in stomach and small intestine. The first one is they are generally absorbed in stomach and small intestine. Then you have to remember aspirin is very low water soluble. So the aspirin solubility in water is very less. Third point, you have to remember 80% of aspirin is plasma protein binded. So 80% of aspirin is protein binded. That's why their volume of distribution is 0.0 0.17 liter per kg. Then fourth, you have to remember aspirin slowly can pass through blood-brain barrier but can easily pass through placenta. So what are the first 4 points? One is absorption generally takes place in stomach and small intestine. Aspirin has low water solubility. 80% of aspirin is protein binded in our body and their volume of distribution is 0.17 liter per kg. And fourth one is aspirin can cross the blood-brain barrier, but that crossing time is very slow. So it will slowly cross the blood-brain barrier, but it can fast and easily can pass through the placenta. So that was the first point that you have to remember in case of pharmacokinetics of aspirin. The other points are fifth one, the plasma half time. You all know what is plasma half time. What we have, I have already discussed all that term in previous classes. Go and check if you forget. The TR for plasma half time is 15 to 20 minutes. And the sixth one you have to remember is excretion or elimination is dose dependent. That I have already discussed when I have discussed about the action of aspirin in urease excretion. If it is less than 2 gram per day, then it will do urine retention. If it is 2 to 5, then it will cause no elimination or no urate excretion or retention. In case of more than 5 gram consumption of aspirin, it will show urine excretion. So their urine excretion is dose dependent. So what are the pharmacokinetics of aspirin points? First one is it is absorbed in stomach and small intestine. It is less water soluble. Third one is it is 80% protein binded and its volume of distribution is 0.17 liter per kg. Then the plasma half-time of aspirin is 15 to 20 minutes. Then excretion and elimination of aspirin is dose dependent. If it is 2 gram per day consumption, then urine retention will take place 2 to 5 gram. It will cause no effect in urine, and if it is taken more than 5 gram per day, then it will cause urine excretion. So it was about the pharmacokinetics of aspirin. Last what we will discuss, last point about aspirin is adverse drug reaction or adverse drug effect of aspirin. The first one is stomach irritation or indigestion. In previous also I have told you, in blood generally due to the decrease in blood clotting, it will cause less platelet aggregation, leads to the less clotting, and it will cause prolonged bleeding time, but it can be easily overcome by vitamin K therapy. Third one is hypersensitivity reaction like asthma, then swelling of face, lips, swelling of throat. All these hypersensitivity reaction also can cause. Then it can cause diabetes mellitus. As I told, it will increase the cellular metabolism due to the uncoupling of phosphorylation in the nerve ending. That will cause the heat production, and heat production will increase the glucose utilization, and that glucose utilization will cause the decrease in blood glucose, that blood glucose decrease level in glucose can lead to the diabetes mellitus. And the last adverse effect that you have to remember is, that is very important, and generally in competitive exam or in class test, in 2 mark question they generally ask about that, that is Reye's syndrome. What are the Reye's syndrome? It generally shows into the infants and teenage. When a infant and teenage is recovering from a high fever or high illness due to the chicken pox or flu, that aspirin in high consumption can cause damage in liver and brain. That is called Reye's syndrome. So what is the Reye's syndrome? That is very important for 2 mark. Reye's syndrome is, it generally shows in infant and teenagers who are generally recovering from a high fever or high illness due to chickenpox, flu or any other reason. Due to high consumption of aspirin, it can damage the liver and brain of infants or teenage. That is called as Reye's syndrome. So by that I have already discussed about the adverse drug effect of aspirin. So that was it for today. So what we have discussed today, I will tell you now in short form. Today we have discussed about NSAIDs, its definition. Then we have studied about how does NSAIDs is going to act. Then we have studied about the classification of NSAIDs. Then we have studied about the important topic is aspirin. In aspirin we have studied what are aspirins, what are the structure of aspirin, how it is going to act, that means mechanism of action of aspirin. Then we have to decide and we have to study about pharmacological action of aspirin as an anti-inflammatory, antipyretic, analgesic, then blood, then how it is going to affect in cellular metabolism, electrolyte balance, cellular system, urate excretion, etc. After that we have studied about the pharmacokinetics of aspirin in different points, how it is soluble, how it is absorbable, what is the protein binding, what is the volume of distribution, plasma half-life, and how that going to generally eliminate from our body. And at last we have discussed about the adverse drug reaction, where we have studied about the adverse drug reaction of aspirin, like stomach irritation or indigestion, then prolonged bleeding due to the decrease in platelets aggregation and blood clotting can be overcome by easily by vitamin K therapy. Then the is hypersensitivity reaction like asthma and swelling of face, throat and lips of a baby or teenager. Then we have studied it can cause also diabetes mellitus due to the overcellular metabolism, can cause high utilization of blood sugar, and it will decrease the blood sugar quantity or amount in blood, can leads to the diabetes mellitus. At last we have discussed about the main or important 2-mark question about Reye's syndrome. What is Reye's syndrome in infants or in teenagers who are recovering from high illness like flu or chickenpox due to the over consumption of aspirin? It can cause damage in or damage of liver and brain of all those infants and teenagers recovering from high illness, that is called as Reye's syndrome. So by that I finish off the NSAIDs, and the most important topic of NSAIDs is aspirin, that also I have discussed today. Please go and check it out, all the previous video about prostaglandin and histamine, to better understand today's topic. Then go through the NSAIDs and at last go through the aspirin and ask whatever problem you have into the comment section, and that two videos description link also is given into the description. Go and check it out. and ask me all about question and your doubts into the comment section. I'll try to answer it into the upcoming videos or upcoming slide. Thank you.